It is just a huge honor for me today to be podcast interviewing Dr. Marc J. Novak, DMD, graduated from the University of Connecticut School of Dental Medicine in 2018, and now a practicing dentist between two practices in northern New Jersey. He was born and raised in East Windsor, Connecticut, with his mother and father both being successful teachers. He entered the University of Connecticut in the education program before transitioning his studies to biochemical research. After completing a research and development summer internship at a pharmaceutical company the summer before his senior year, he knew that a life stuck in a lab was not for him, and he chose again to transition to dentistry after observing his local dentist, Dr. Pete Coombs of Suffield, Connecticut. While applying to schools, his undergraduate research advisor convinced him to continue his work and stay for a master's degree. His research project focused on increasing the chemical stability of proteins that could be used for functional purposes. He published several peer-reviewed journal articles pertaining to the increased functional stability of glucose oxidase, acting as the building blocks to a biocompatible glucose sensor that has the potential to send electrical Bluetooth signals through an app to register live glucose readings and limit the pain and annoyance of patients using drops of blood from their fingers. Upon completion of dental school, he was selected to attend the highly competitive GPR program at Morristown Medical Center in Morristown, New Jersey, ranked the #1 hospital in New Jersey and top 30 hospitals in the United States. He received advanced training of complex dental cases, including oral surgery, endo, implants, aesthetic cases. He received a formal education on management of medically compromised patients, as well as patients with special health care needs. Becoming a more well-rounded and confident practitioner afforded him the opportunity to enter private practice as an associate under the tutelage of Dr. David Paulison of Hackettstown, New Jersey, and Dr. Michael Gruber of Parsippany, New Jersey, both of whom are annually recognized as two of New Jersey's top dentists. When not splitting his time between the two offices, Dr. Novak is passionate about continuing education to become the best practitioner possible, as well as staying physically active and traveling. He hopes to use his expertise to provide the best possible care to his patients in a relaxed and welcoming atmosphere, and make patients an integral part of their own treatment by educating them to the fullest extent as to the care they will be receiving. I wanted to bring him on because you're just 2 years out of school, and you just went through everything from A to Z about residencies, and everybody in dental school is thinking, well, should I just graduate and get a job get a job? Should I do a GED? Should I do a residency? And when I graduated so long ago, I don't even know, they didn't even have half the letters of the alphabet when I graduated in 87. So I thought it'd be really cool to bring you on 2 years out of school to go over what are the benefits of choosing a GPR or an AEGD over going right into private practice, and knowing what you know now. What did you think of your decision?
Well, I just looked at it as, in school, we always were taught, this is what a crown is, or this is what a root canal is, and the theory behind them. But when you leave there, no matter how many students you have or how many patients there are, there's always cancellations for a 4-hour block to do like an MO composite. And it's not as practical to learn it from just the school. Everyone may think that if you finish school, you should be ready to go out and work like anything else, finance, business, things like that. But I looked for something that was going to sort of increase my speed and efficiency with procedures, and residency was going to be that to a T. I looked into a couple different programs, and the Associate Dean of Students at the University of Connecticut actually was on a accreditation faculty that goes and basically looks at all the GPR AEGD programs around the country. And when I asked him and narrowed my list down to a couple, he had said, this one may be one that you should look into down at Morristown. And when I went to visit, I left basically saying this is the only place I want to go after watching it just for a day, pretty much.
Okay, well, this podcast, there's 2 million dentists around the world. It's a huge popular show in Asia and Africa. So tell my homies, what's the difference in a GPR and an AEGD?
The traditional difference, I guess, from what I understood it as, was always defined as a general practice residency, or mostly as hospital-based, as opposed to an AEGD, which, advanced education always went through more of like an academic-based. or, at schools or things like that. But I believe the lines have been blurred a lot more to those. There's programs that are AEGD programs that are being housed at, health centers and all different ways of looking at them. So I guess the traditional way you would look at it is a GPR is more in the hospital-based program where you're going through rotations and maybe doing more oral surgery to an extent. Whereas in AEGD, you're taking possibly more classes, you're doing more research, maybe like writing proposals and things like that. But for the most part, I don't think they're tailored one way or the other anymore, just because there have been so many that have been sort of combined in a way that they offer the same aspects of them now.
And what do you think? So it's really not it's not really a distinction anymore. Would you almost call it a synonym at this point?
At this point, it's definitely closer to a synonym. There are some programs that are definitely more keen to research or keen to those little aspects of dentistry, such as public health or little things like that. Whereas GPRs, being in a hospital, you're going to see more hospital-based patients. You're going to see more emergencies, and that's not to say that AEGDs don't see the emergencies and things. That's sort of the traditional definition, but I think they're definitely getting close to be synonymous.
What I noticed in the last 32 years is, a lot of states would have like a big city, but the capital would be in a small town and the university would be in a small town. And like in Kansas, where I grew up, the med school was in a small town, but Wichita was the biggest town. And a lot of these residencies, I would always hear people saying all the time, saying, make sure it's in a big town. I mean, if you're doing a residency in LA, you'll get so many more of the rare cases than if it's in Salina, Kansas. And I've noticed that in Kansas, the medical schools are moving their clinics and hospitals to the biggest town. Like Phoenix is building, U of A's in Tucson with 800,000. And now they're building a hospital here where there's 4 million. So would you say that if you're going to pick a hospital-based residency and you want to get the most rare cases, that you'd want to go do a residency in the biggest city you can find versus the smallest little university town you can find?
I think that they're definitely, in just terms of sheer, my grad school professor used to say everything is probability. So I think the sheer probability of things, of finding them in a big city with a higher population, may be greater. But at the same time, even, the way we were described at Morristown, where we are, we're a level 1 trauma center, in North Jersey, and we're pretty much the only one until you hit Eastern Pennsylvania, Western New Jersey, Northern New Jersey. And then as you move east, they have Newark and Beth Israel and all those that are over there. But even a town like, I had never heard of Morristown before. Actually, one of my friends from college moved here, and you go and you look into some of the cases and things that we did. And again, you may find more of those cases and a higher probability in the big city. But I think as a population increases, the number of hospitals also increase. So it may just be taking away from its own pool in that sense, versus if you stay, in a hospital that may be a little more toward a rural area or a little more small urban area. A lot of people look at it as, well, this is definitely the place I have to go because it's the only place within, a certain traveling distance.
So you're in New Jersey now. Are you in Parsippany?
Yes. So I live in Morristown right now, but I practice in Parsippany 2 days a week and 2 days a week in Hackettstown.
Well, for my international viewers, I can assure you that New Jersey only has 2 types of people. They're either Bruce Springsteen fans or Bon Jovi fans. Which one are you, Dr. Novak?
Springsteen.
They always have an answer. They'll never say, I don't know. So why, she's coming out of school $284,000 in debt. So her walnut brain's spinning, dude, I want to go get a job at Aspen or Heartland, or I just want to get a job and start paying down those student loans. How do you sell an GPR and AEGD of student loan, money versus, more education? How did you wrestle that mentally?
I mean, leaving school, everyone definitely looks at, if you have student loan debt, that's going to be a big consideration what you do next. Even not residency for a GPR, residency for specialties. If you choose to do 4 to 6 more years for oral surgery, it's a real consideration money wise and time wise, what you're going to be getting versus what the output will be from that. The way I sort of tried to look at it when I was wrestling between those was, in my amount of time that I put in the investment to become where I am as a practitioner leaving school, would I rather take one more year in a GPR where with this specific program and certain others, I'm going to be getting a higher level of education from attendings who are going to be there with me and giving me tips, versus, the early stages of money sound really good. You sign these contracts for, could be $200,000, something like that. And it sounds, wow, that's great. I'm going to make that out of school. But what's your long-term goal? Do you want to learn how to run a practice efficiently? And if you don't have the go-get-itness and you just sort of get locked into those positions, I mean, if your long-term goal is to be an associate at an Aspen Dental or somewhere like that for the long term, then that's a great place to go and start early. But if your long-term goal is to start your own practice and be your own boss and just try to get as much education as you can as early as possible to set yourself with a good foundation moving forward, then I think that a residency in AEGD is a great way to go and get that education and be proactive about it. Because, at those Aspen Dental places, there may be something you want to learn, but your schedule could be packed for the whole day to the opportunity where you don't get to go out, ask attendings or ask other dentists what they're doing without paying, sometimes thousands of dollars to do CE trips to San Diego or Seattle or anything like that.
I love your post on Dental Town. One of the 50 categories is residencies, AEGDs, and GPRs. And you're posting an answer to one of these guys' questions. And some of the questions in that thread I thought were pretty interesting. We're saying, how would you decide whether to do a AEGD, a GPR versus military or public health?
Well, especially for military and public health, if you choose to go the military route, I think that it should be for reasons above and beyond just dentistry in a way. If you're focused on serving your country, because everyone knows that the military is a great option in terms of, managing your debt, long-term benefits. Formal education for the military GPRs are fantastic. They're very competitive to get into, but you have to go through the rigors of joining, a branch of the military. So if you're not willing to go through what it takes in order to do that, I wouldn't look at that as something, I'm just going to do this because I'll be able to pay back my loans easier. In terms of doing an AEGD versus GPR at that point, it's, what do you look for in terms of, do you anticipate yourself being in an area where it's going to be a high volume place with medically compromised patients, like a big city who somebody could just wander in off the street? Or for AEGDs, are you sort of focusing more on, in a way, even though, like we said, the line is blurred a bit, are you focusing more toward maybe like a path in academics? Do you enjoy the research? Do you want to try to get a little more hands-on, but also deal with research articles and things of that nature as well?
So this guy posts, do you have an AEGD or GPR that you absolutely recommend or not recommend? I thought that was a weird way to, so he's basically saying, is there one you love? Is there one you hate? And basically, you said that at Morristown Medical Center, New Jersey, you couldn't recommend this program highly enough. Why is that?
I mean, even at the time when I wrote that, we were getting exposed to a lot of complex cases that, you come out of school and you just kind of you're like a deer in the headlights. Sometimes some of these things walk in. In terms of, like I said, if you're going to spend the 1 year and in a way as a financial sacrifice, a time sacrifice versus going out and getting a job somewhere or getting a job at Aspen Dental, you'd want it to be the most well-rounded in a way that you can deal with. A couple of examples I can give that really attracted me to Morristown as a GPR. Number one was when I went through there and saw how the program runs. It's run as efficiently as possible. About like 6 or 7 residents easily could make that place function well, but it's run with 4 residents on purpose. They want those residents to deal with pressure. The director, Elizabeth Clemente, and she's the treasurer of the AGD actually now. Her philosophy was always, practice should be harder than the game. And that she would say, I want you to leave here after 1 year and say, I'm exhausted, I'm kind of beaten down. This was a hard program. But then for the next 30 years of your life, you're like, well, this is easy compared to what I did, for a year in Morristown. And so far, my experience being out in private practice, it's been like that in a while. I talked with my co-residents who I graduated with, and we're kind of like, sometimes there's some days where you sit there just starting out as a new dentist. You're like, man, I kind of miss the chaos that you were dealing with in the hospital, because Morristown being a level 1 trauma center, we were the only residents there pretty much for the shoulders up. There were no plastic surgery residents. We would go and help plastic surgeons. There was no ENT residents, so we could sometimes go in with the surgeons in the ENT cases. And as far as oral surgery, if they came in with gunshot wounds, car accidents, drunken falls, anything under the sun as far as mandible fractures, ZMCs, skull fractures, we were in on those cases, working them and learning how to, put these things back together.
I really love that what you said on the, what did you say? You said practice harder.
Practice should be harder than the game. So
yeah, and Stephen Curry says, I want to practice to the point where it's almost uncomfortable how fast you shoot, so that in the game things kind of slow down. Stephen Curry, and this is a big controversy, I think, that really makes a lot of specialists mad. I tell these kids, they never want to do any molar endo. And they say, well, I don't know if I'm good enough. And I said, well, how are you going to get good if you don't do 100? I mean, until you've done 100, you don't even do molar endo. And they go, yeah, but the endodontist was, they would do it better. And I said, well, who did the endodontist first 100? I mean, what was it? Did Stephen Curry show up and say, let me do the first 100 for you? I mean, you got to start somewhere. It's kind of like when you're in an airplane and someone's all upset because some kid's crying. I would, and they're stressed out to mom. I always say, well, how old were you when you were born? So
right.
Everybody's got to do their first root canal. And I love that you just got to get in there and do it. Same thing with programmers. There's all these programmers who go to 4 years of school, and then there's programmers that just sit there and come home from high school and they get a book called Programming for Dummies and decide they're going to write their own video game app. And a year later, guess who's the better programmer? So just get in there and do it.
And so, like you said, also, doing root canals, just as an example, when we entered the program, we had all different interests for the residents who were there. We had one who actually, he's going to be an oral surgeon now. So he was very into oral surgery. So by the end of the program, he was doing, 3 implants in a row, doing, Ramus like block grafts for implant sites, doing all kinds of things because he was challenging himself through the program. Dr. Joelle Hirschfeld, one of the other residents I was with, she loved aesthetic cases, and she did a beautiful, pretty much full mouth rehabilitation on this person that you just couldn't believe the difference that she made for this person. And I really liked endo, so I would try to pick everybody's brains about what their methods were for endo, how they went through and did their cases. And we had 3 or 4 endodontists, but we also had 3 or 4 general dentists who are very, very good at endo that could teach us a lot. So Dr. Clemente, actually, by the end, she prints off your production, and she tracks your production every quarter to show you what you need to be doing more of, what you may need to be doing faster. And so by the end of the residency, the last printout I got, I had done 47 anterior root canals, 31 bicuspid root canals, and 27 molar root canals. And that's something that I wanted to do. I can't even imagine how many teeth my co-resident Peter took out by the end. It was probably astronomically high.
Well, it's neat because you would think if Dr. Elizabeth Clemente was in some hospital medical center that she wouldn't be thinking about practice management and production and everything. How do you think where do you think this comes from with Elizabeth? Why is she thinking like a business inside of a GPR that has to, real world, has bills to pay?
Yeah, I mean, I think that she is sort of a combination with her where she wants us to challenge ourselves and practice, doing these procedures to get better at them and be better dentists. But she also stresses that, there is a real world component to dentistry where you can't just do this as a hobby. If you're going to do it, you should learn to do it in a way, the right way. So during even these printouts to give us our production reports, she also will standardize them to be what the average cost of this procedure is in, New Jersey or Morris County, just so we have an idea of how, when we get out and we run a practice, if you leave there and you've only done 5 endos, but you've done, God knows how many molar extractions and, like wisdom teeth extractions. Okay, well then maybe this is something that I've learned I should refer out and spend my time doing extractions more, because those are something that I feel more comfortable or feel better at. So in terms of crafting better practitioners, she, I believe, looks at it as like a full practice point of view, that we're not just going to be teachers, we're not just going to be in like residents forever, we're going to be practicing dentists, and she wants us to be the best ones we can.
But that still is what I find most kids get caught up on. They're never going to get good because they're going to refer everything they're not good at when they're babies. I'm like, I mean, you're not going to master a pulpotomy until you've done at least 100. You know what I mean? Same thing with molar endo, same thing with extractions. And I don't know why, but I didn't care. I mean, if I said I was going to pull a wisdom, I didn't care if it took me an hour. And I remember when I got out of school in 87, at least once a month, I had to take the patient to my car and drive him over either down the street to the oral surgeon or Don Gas, or I would drive him to my the other direction. If the oral surgeon's open Monday through Friday 8 to 5, but there was a guy down 2 miles down the street, and I would take him to him, and he'd always joke. He'd always shake the patient's hand. He goes, "No big deal. Howard always takes out the top half of the tooth, and then he brings him here, and I take out the bottom." It was Bob Sundberg, who's now up in Prescott, and he was such a great colleague, and he always thought it was funny. But the fear that they wouldn't be able to get it out just paralyzed them, and then they'll never try it again. So how would you talk a young kid? And then the other thing that stressed me out is that they come out $284,000 in student loans, and half the class is already determined at graduation they hate molar endo and they're never going to do it. I'm like, dude, that's $1,000 procedure. You have to sell bleaching bonding veneers. You don't have to sell, I'm in pain, I can't sleep, will you help me? And insurance will pay 80%. And then it goes back to public health. I mean, come on, you're public health. A patient just walked into your office in pain and you can't treat that when 8% of emergency room visits are odontogenic in origin because all the dentists are either closed or they decide they just don't do that. I always tell these dentists, imagine you broke your arm, you go to the hospital, and they go, "Oh, I'm sorry, doc, we don't do arms. Yeah, we used to do arms, but you know what? We just don't like arms. We only do legs." Like, dude, you're a hospital. You're a dentist. It's public health dentistry. It's available to access. They got a toothache. You're doing a molar endo. And if you don't like it, it's because you're not good at it. And if you're not good at it, it's because you haven't done 100 of them. So go do 100 of them until you like it. So how do you walk them off the cliff to go do something they're not going to like?
Well, I think that's part of it when we talked about people who want to, or students who want to go to Aspen Dental or Columbia Dental, these kind of things. After those places serve a purpose, and they are a great business platform for people who go in there and they need help with something. But the safety net of certain places like that are going right into private practice is that you have someone who's going to say, "Oh, you don't like molar endo? Well, we have an endodontist who comes in every Thursday, so he'll do it all for us, and you don't have to learn it. Just worry about fillings and crown and bridge." Whereas the residency programs that I visited, if it walks through the door, you're doing it. It's you have to learn one way or another. And in my program, we had certain days that were blocked off based on the attending. We had over 100 attendings who were volunteers that would come to the hospital, between general dentists, oral surgeons, endodontists, prosthodontists. So you had an idea of, if I'm going to do, this molar endo on a number 18, well, I kind of want to do that on a day that the endodontist is here, so you could tailor your schedule to that. And, they would always show up for us. Same with oral surgery. By the end, we were able to somebody comes in, says, oh, I broke this tooth. All right, by the end of our program in May, it's like, okay, I can just take this out. Let me section it, pop the 2 roots out, in and out. But at the beginning, when you have these oral surgery days and you're a little nervous about how to get this tooth out because it's decayed to the gum line, you learn some of their methods, and then you sort of go back and say, oh, now I know what to do the next time this walks in. And you know what? You very well may mess it up and be putting a phone call into Dr. Press, who's working right across the road, and say, I broke this one. And there were times where him or, other oral surgeons would come in and have to help us with certain procedures. But as far as the referring things out, the benefit of the residency was if I got certain molar endos to come in now, when I was just out of school, I'd be like, there's no way I'm doing this. It looks too intimidating. And now by practicing in a residency program and learning these advanced techniques and little like tidbits, not even techniques, just like little analytical things you learn from other dentists, your fear level goes down to the point where somebody comes in and, like you said, oh, you need a pulpotomy. All right, go give me a rubber dam. Like, we'll just access, we'll take a 10 file down there. Like, no problem. And I still have my other patient in the chair ready to go. I know how to balance between these.
So if they're listening to this on iTunes, they're thinking, my God, what GPA did you have to get in there? If they're watching this on YouTube, they're saying, well, hell, Elizabeth accepted you because you look like Russell Crowe in The Gladiator. My God, if you're not Russell Crowe's son, I don't know who you are. But how hard is it to get in these residencies?
It's definitely, first of all, my assistant that I had in Morristown used to call me Russell Crowe as a joke because one of the patients that we had come in had said it. So I think it's just funny you brought.
Dude, you look like Russell Crowe. You should maybe you could be his bodyguard or his double in a movie when he has to fall off a horse. But is it hard to get in? And also when you're trying to get in, I mean, do you just want to get in any place that'll take you, or are there red flags, like knowing what you know now? Are there like GPRs and AEGDs that you wouldn't even want to go to, or is there? So are they hard to get in, and what are the red flags, the ones you don't want to get in?
I think they're hard to get in only in the sense, not only, but in the sense that it's a numbers game. So there's only X amount of residency positions available every year, for GPRs and AEGDs, oral surgery, endo, everything. So if there's more people who are applying than actually get in, it just becomes a numbers game in terms of it being challenging. And, it's more difficult to go to a place that you really want to go due to sometimes the process, which is the match, right? So the match is basically an algorithm that a lot of places will go and let's say I interviewed at, Morristown, Wichita, Arizona, and San Diego, right? And I ranked them 1, 2, 3, and 4. Well, the other residencies could rank me, 5th, 11th, like 2 or however. And it's sort of like a crapshoot. So where the place I really want to go, my number 1 choice, you may end up in your number 3 choice. So you have to be cognizant of where you match programs. And the same goes for oral surgery, and the same goes for prosthodontists and orthodontists. So that part can be definitely stressful. The benefit to doing your research about programs, Morristown, where I went, they dropped out of the match. She just said she wants to pick who she wants to go to the program. And when you go to the interview, that's it. They make their selection. So it's a non-match program. I know that the year that we had applied, I believe there was about 88 or 90 people from across the country who applied to Morristown because we interviewed with people from VCU, Marquette, USC, and when they were interviewing going through there, it has a very good reputation, but mainly one of the best things you can do is talk to former residents who went there and gauge their experience. And I would say not just one person, but do multiple people so you can get sort of like a composite of what multiple viewpoints had on the program.
So would you say a GPR and AEG, okay, so first there's specialists where someone just says, I want to be a pediatric dentist. I only want to train that. So that's a specialty. Whereas a GPR is AEGD, they want more training. Do you see a lot of people do a GPR and an AEGD and then later go on to specialize? Or have they already passed it? Like, I know I don't want, like, I knew right out of the gate, I don't know how you could do one thing. I mean, I didn't want to do like only molar endo the rest of my life. I mean, I just, what I loved about family practice is that, you know, the variety. It scared me. Like someone who gets a gold medalists have a really high alcoholism rate because, I mean, it's a true story. I mean, if you swim the 100 meter for an hour every morning before school, an hour after school from age 5 to 25, you know what the chance of burnout is, where one day you just say, I never want to swim again. I mean, so I don't know how a guy just sits down and says, I'm going to do, you know, 5, 6, 7 root canals a day, 5 days a week for 40 years. I didn't want that. But are you seeing that the people who know they only want to do one thing, they're off, and the GPRs and AEGDs want more training for family practice? Or do some people find out in GPR that they really only want to do endo or pediatric dentistry?
Yeah, it's a great question and a great point, because one of the things that a lot of schools may not pressure, but sort of direct people toward is, well, if you know you want to do oral surgery, you got to apply now. You have to make your decision. If you know you want to be a pediatric dentist, you have to apply now. You have to make your decision. And from my experience, it's also been that while it's great to apply out of school, you also have a lot to learn about what it is you really like in real world dentistry, and not the like sort of sheltered atmosphere that dental school can be. I had a good example with my co-resident, Dr. Peter Hanine. He was on the fence between oral surgery and general dentistry, and he chose to go to Morristown for his GPR. And after the first, I would say, 3 weeks to a month of doing the oral surgery days that we were doing, interacting with the oral surgeons and seeing how they worked, and just seeing, you know, his talent or skill for certain procedures, he made the call and he goes, I'm going to apply to oral surgery. I want to do this for the rest of the time. But he also challenged himself for the rest of the year. He didn't just stop doing crown and bridge, and he didn't stop doing root canals. He still did all those things. And he said, I'm never going to get to do this again, in a way. So I need to make the most out of it while I'm here. And I think that's a very positive attitude to have about it. But the benefit is, when I was considering going into endo and being an endodontist, the chief resident who I was picking his brain about it in dental school, I was a third year at the time, he said, listen, if you want my advice, either go into practice or do a GPR. And if you go there and you say, I never want to take out another tooth, I never want to see, you know, another kid, I never want to do another crown, I never want to do another denture, then go into endo. He goes, but if you leave there and say, I kind of like still doing a little bit of everything and being the quarterback of the team, he said, go general. And I think that a lot of times general dentistry is sort of trending upward with all the CE people can take and all of the additional skills that people are learning, that, you know, general dentistry is a great field to go into. No one says you have to refer out all of your endo, or you have to refer out your every extraction you do. You learn how to do those things to the best of your ability, and you learn, you know, when to call it quits or when to say this isn't for me.
I want to switch to this is Dentistry Uncensored. I want to switch to the uncensored, ugly part of this conversation. That is, you just got out 2 years ago. I was 32 years ago. Has the amount of student loan indebtedness, you see it having kind of like moral hazard or weirdness to the profession of dentistry? I mean, are people making a lot of different decisions based on their student loan indebtedness, like as opposed to specialize or GPR, or get a job, or do you think it's been perverse incentives having $284,000 in student loans on average coming out of dental school?
I do. I mean, when you look at the numbers, you just compare, obviously, inflation, all these different things, what it cost, you know, 20, 30 years ago. It's a vast difference now. However, I think it weighs on a lot of people that say, you know, okay, well, I just spent, let's say, $280,000 to go to dental school. They may have $100,000 in undergraduate loans that have been compiling interest for those 4 years. And in a way, with other things weighing on their mind, whether they're going to get married, buy a house, it may be more difficult to justify 6 more years of oral surgery training when you're concerned about those finances going forward. That being said, if you choose to make the investment in yourself and bet on yourself to become a dentist or an oral surgeon, then it just means that in a way you have to also have the priority of being smarter with the finances that you have coming out. I think it's definitely become, in a way, perverse. It's very difficult when you just look at the rate of interest, and there's people you could pay $10,000 a month, for, let's say, a full year after you get out, and you really only put maybe like a 30,000, 40,000 dent in your actual loan principal. And that compiled over many years it's difficult to do, because I don't know who's paying $10,000 a month toward their loans right now. So I think it does weigh on people. I think the smartest thing you can do, though, is, even if it's almost what seems like a minuscule amount, like $100 a month, anything, paying back toward your loans as quickly as possible becomes the best investment you can make in the early run, versus people who just say, well, now I have money to put in the stock market. Now I have money to, put into this rental property, this house. It's sort of, I personally hate being in debt. I would rather chip away at the debt that I've accrued and look at that as paying down the investment that's sort of weighing on me right now.
I want to ask you another question. We're seeing a lot of people get out of dental school, and they didn't get accepted into orthodontic school, and instead of accepting they find an orthodontic program in the Caribbean, in Central and South America, in Eastern Europe. What do you think? What do you think of the decision? Let's say you really wanted to be an orthodontist. You came out of school 2 years ago. It was no, but you found a place in the Bahamas that would accept you. Are you seeing much of that? Is it? Do they work their way back in the fold? Does anybody even care where they went to school? Because if you have the money, you can just go to any graduate school. I mean, I've been to these schools all over the Caribbean. If you got the money, they'll take you. Are you seeing that, or are you not seeing that much?
I personally haven't seen it that much, but at the same time, I think far be it from certain programs to say, if your passion is orthodontics, orthodontics is its own sort of monster in terms of, if you want to just be doing orthodontics all day, but you're sort of being told, well, too bad, do crown and bridge, then you're going to want to go to whatever avenue and lengths you have to persevere and get into an orthodontics program. I don't know personally about coming back into the fold for a lot of those orthodontists or oral surgeons, or however those training programs go. But if people are really going to, like I said, make the investment in themselves, and they feel as though they have a better shot of going to the Caribbean or something like that to get their education, versus practicing for 2 or 3 years in private practice and then keep applying year after year for the prospect to get in, then I think people should bet on themselves if they're that confident.
That is interesting. You also, one of the things I love when you talk about is creating a young dentist executive board with mentors across different disciplines. I mean, it's one thing to think that you're doing a residency, but you can have an eternal residency if you have a mentor. So what does that mean to you, creating a young dentist executive board?
So that was a philosophy that I got from one of my attendings at the hospital who came in to talk to us a little bit about what to expect, in a way, getting out. And one of the reasons why I wanted to go to Morristown versus a program in Connecticut, I've been in Connecticut my whole life, was a lot of the programs from Connecticut have people who were trained at UConn. So you want to learn these different viewpoints and different aspects from different people. But more importantly than that is, if you go out in a private practice and there's one other doctor there with you, you can learn some great stuff, but there's also the potential that you could pick up some bad habits. So what I mean by the sort of young executive board is, there are certain dentists who are out there that are, I'm sure you've seen, their techniques, their way of practicing in terms of their just hand skills and the way that their crown preps look, those are the guys you want to learn how to do crown preps by. There's also some dentists who own 6, 7, 8, 9 practices. So if you look more on the entrepreneurial route, or you want to look into investment in your practice, maybe that's somebody who you want to make sure that you have contact with in the future. And, you know, you let them know, this is what I want out of my career. And I'm making sort of like an executive board, and I want you to be a part of this. The 3 or 4 dentists and specialists who I went up to that I talked to personally and said, I want to make you a part of my sort of quote unquote executive board. You know, they were happy to, you know, be a part of that. And they have so much knowledge that they want to share. And if you can take the viewpoints of 5 to 8 different people and create your practice around that, it's like playing sports. You may have a coach that does things that you really liked and did things that you really hate. Well, if you ever become a coach, you want to do more of the things that you liked and less of the things that you hate. So if you have 8 or 9 coaches growing up and you have 8 or 9 different viewpoints, that sort of becomes the crux of what forms into, you know, like Jim Calhoun, Mike Krzyzewski, and all these other coaches out, Nick Saban. That's how they get to where they are. So if you want to learn to be the best, you try to find a way to learn from the best who are already doing it.
Nice. So back to maybe moral hazard of having so much student loan debt or perverse incentives or whatever. A lot of kids are asking, okay, when I come out of dental school, are some areas of dentistry more marketable than others? Let's say she doesn't want to be a specialist, but she's picking between, should I learn Invisalign or place implants? Should I join the AACD or maybe one of these sleep apnea organizations? What do you advise her to do? Supply and demand, from being where you're at now, what do you think society is willing to demand more that they need a supply of than, say, other areas?
Just from, you know, a sheer numbers standpoint, if you're going to choose to do a residency or even go into private practice right away, I think that the most amount of procedures and the things you should really get good at is your bread and butter, you know, restorative, crown and bridge, and endodontics. And you need to get better at those procedures in terms of your efficiency, right? So if you want to do, you know, Invisalign and those kind of things, but it takes you 4.5 hours to do a root canal, that's going to balance out to the fact that you may not have had the most productive day. So my goal in residency, and I think the goal of a lot of people when you first get out, is to get better at those procedures that you're going to see in and out every day and be able to manage them. After that, and, you know, you feel as though you have a good grasp on them, you know, I guess what most people are looking for in a way would be something like Invisalign to straighten their teeth. Now, don't just take the course and be like, oh, I took this course and now I know everything about Invisalign. It takes a lot of practice and like almost like a whole nother realm of school in order to do Invisalign and do it well, because it's just like anything else. If you do a crown and the crown keeps falling off for the patient because the prep wasn't done well, they're going to come back and have problems. If the Invisalign was done, but you have, you know, keep putting the patient in refinement trays and all these other things because you don't have the full education, it may not be the best investment of your time. So my viewpoint has been, I wanted to use residency to get better at crown and bridge, working efficiently, and my endo. And it's really paid off for me in private practice for when I was able to moonlight starting in January of my residency with Dr. Paulison, who I work for now. And I'd be able to go in there and be like, well, you know, this guy, you know, needs a root canal. Are you okay with that? Like, yeah, put him in the chair. Let's go. So it gives you that confidence to go forward with procedures that walk through the door every day. I don't know how many times you really see somebody say, you walk to the door and say, oh, I need veneers, or, oh, I need Invisalign. But I would be willing to bet that it happens far less than somebody saying this tooth hurts over here, or I broke this filling, you know, on the side here. So for you to be able to work those people into your schedule and learn how to do it efficiently, I think is the most important thing that you can get down being 2 to 5 years out of school. The full mouth aesthetic cases that you see people going to, the, you know, complex Invisalign, the learn your own ortho, the sleep apnea, those things will come in time. But if you're dedicating most of your time to learning sleep apnea and you haven't been able to get your crown preps under, you know, an hour and a half, there becomes a balance that you all of a sudden don't manage your time very well in private practice.
When you told them that, yeah, Can you do this root canal? And you said, yeah, throw him in the chair. I'm ready to do it right now. Did you say it in the voice of Maximus when you were in Gladiator, or more of Jim Braddock when you were in the Cinderella Man?
Probably more of the Gladiator, but less of like a gargly tone to it, less yelling. I would say too. Probably it was more like, yeah, like okay.
Hey, another question under the GPR deal was these kids, again, because of student loans, are asking questions on Dentaltown under these GPR topics. Do you think they need to have disability insurance and life insurance? I mean, so you're single, you got all these student loans. Should they really be getting disability insurance or life insurance during a residency? Or are you just bare boning it? You're single, you get ran over by a truck, whatever. I mean, what were your thoughts on disability and life insurance during residency?
I mean, as far as disability insurance goes, we had the benefit of our program was we didn't just talk to dentists. We brought in financial advisors. We brought in dental lawyers. We had all these lunch and learns with different people. And one of the ones for the disability insurance was, oh, do you guys like being dentists? Like, yeah. Like, oh, what else do you like to do? And if someone said, I like going skiing. All right, well, what happens when you're skiing down a mountain and you hit it, like you hit your elbow against a tree and you all of a sudden have nerve damage and you can't work? Oh, for just getting out of school, it's little things like, oh, I guess I didn't think of that, being, late 20s, you're like, I just want to go out and have fun and go skiing. But now your livelihood has to be protected. So I would definitely recommend disability insurance as early as possible in your career. And, you can't be a dentist without malpractice insurance. So that's going to be an important one. And, for myself, someone who is, maybe not having a family or anything right now, life insurance for me may be a little less of a priority, but I know several people who are now right out of dental school with 2-3 kids even. So life insurance should be a priority for you if you're now going to be a working professional.
So another question they're asking is, again, what is more valuable now? Like there's perio, there's oral maxillofacial surgery, there's implants, but there's a lot of ones that they're not so sure about, like orofacial pain, sleep apnea. There's even people asking, like, is this orofacial pain? Is this sleep apnea? Is that really going to be as important as, say, perio or implantology? What would you say to someone who wanted to do a residency that focused on orofacial pain, TMJ, sleep apnea, things like that?
I think orofacial pain, like temporomandibular joint discomfort, especially when it comes to the procedures we're seeing done now and suggestions that are being made with research coming out, is going to be a bigger field in the future. Like dental anesthesiologists just became, a specialty. And so would you have thought maybe 20 years ago, like a dental anesthesiologist being a thing? Like, not really. So in a way, who's to say that 20 years from now, like a dental sleep apnea person who specializes specifically in orofacial pain, sleep apnea, and TMJ disorders becomes a specialty, with more and more people, going through the process of coming in, the diagnosis becomes harder and harder. It also becomes more and more difficult to find somebody who has the educational background to assist these people with what is causing them pain. And above all, that's why they end up in our chair most of the times. They're in pain. Something's wrong.
Okay, are you married with children, or are you single without?
Single without.
So that's another question. She plans on getting married right after dental school, and they're ready to make a baby. Is getting married and making a baby and starting a GPR or an AEGD, are those things that don't go together, or do they go together? Did you see that work out for some of your colleagues, or did you see it to be a big red flag no?
No, I saw it work out for plenty of my colleagues. And, it's not to say that it will make things easier, because obviously it won't, but it's just an added variable that these people have that, it's going to have an added challenge. One of my co-residents was engaged, she had to work on planning her wedding during, residency, and she was able to still become an excellent practitioner while doing that, raising a family. And those kind of things, I've seen it done by some people who I graduated with who had kids, right as soon pretty much as we graduated, and then had kids right before residency or something. But they made it work. They were successful. They got very good jobs after. So that's not to say like you can't do these things or anything. I think as long as you have the knowledge that it may be an added variable and challenge for yourself, but you're willing to go through that work because a family is really what you want, then you should definitely, again, pursue that if that's what's going to make you happy and, you know, what you want out of life. There's no need to delay it just because, well, I got into a residency, now I can't do it. I don't think that's really part of it at all.
You mentioned dental anesthesiology. That's the 10th specialty that was recognized last year. I mean, I when I got out of school, there were 9, and it took 30. I think it took 30 years later to add a 10th one. Do you think that's going to be a big one like endo, perio, pediatric, all the others? Or do you think it's going to be smaller like prosthodontics and, public health or something like that?
I personally think that dental anesthesiologist is going to have a bit of a exponential curve in a way. I think it's going to start small, obviously, because there's only going to be X amount of programs that are accredited in order to have that program. But even just today, in my office in Parsippany with Dr. Gruber, we have a periodontist who comes in and, you know, places implants, you know, every other Wednesday just to like, you know, deal with the volume. And of the patients who he was doing consultations with, I would say 3 or 4 mentioned, well, can I be put out for this? I don't want to be awake for this procedure. With the advent of, you know, Smile in a Day and all these all-on-4 cases that people are now seeing, you know, advertised on just, you know, basic cable, people start saying, well, I might want to do that. You know, that is going to be an even growing part of the dental practice is the all-on-4, the all-on-6. And patients are going to want to be sedated for that. So while a general anesthesiologist may be able to do it, somebody who also knows about the dental profession is going to find themselves in a lot of work, I think, in the upcoming, you know, 10 to 20 years if you look at the way things are trending in dentistry for us.
Yeah, I couldn't. It seems like, to me, anytime someone's done a big sample, chose their sample size correctly, when they took a sample, they threw it back in the pool. It looks like the United States, about half the country is afraid of the dentist and half the country's afraid of the price. So if you're addressing lower cost or less fear, I would think dental anesthesiology would be very, very big. When someone, you said Elizabeth pulled out of the matching system and just wanted to do her own interviews.
Yes.
I find that very genius because when I talk to dental school deans, and we've had several on the program, what they fear the most is that they're stuck for 4 years with someone that no one likes or wants to be around. And they're like, I don't care if you're a 4.0, you know, you finished all your requirements when you were age 5. They don't care. They, at the end of the day, they want to hang out with someone they like. So when you're applying for an AEGD or a GPR or a specialty or any job in dentistry, what questions are you asking? What questions do you think they should ask the directors of this program to decide if they're a fit? I mean, maybe that kid, maybe they're a Cubs fan who likes to drink beer, and there was some group of people that hate the Cubs and only drink wine. What questions would you ask if you were applying for getting in one of those programs?
I think the most important one that sometimes can be overlooked, if you read all these things where they say if you're in an interview and they say, do you have any questions, you should never say, nope, I'm good, you know, and walk out. That's like a red flag for the interviewee right there. The most important thing, I think, you know, because I believe around this time of year when this is posted, it'll probably be around prime interview season for residencies. The first thing they should be asking is, what are you looking for in a resident? Because what the answer from the people who you interview with, what you get is going to sort of allow you to drive the conversation a little bit more, to make yourself present yourself in a way that you seem like the best candidate for this program. Or they may say, like, just somebody who shows up, you know, whatever, and, you know, does their work. Like, okay, well, I want to be challenged in a way. Maybe this isn't the place for me. And it helps you get a better idea of, if you're doing the match process, where you want to rank these programs. Some other good questions that I can remember being there is, if you are in a GPR program and you're going to be taking call for the hospital, like you said, I believe what was it, 8% of dental emergencies is what makes up an emergency room per year.
Yeah, 8% odontogenic and of origin.
And I think my co-residents, I would disagree. We probably call it more like 30% the amount of time we spent in the ED. But, you should ask and get an idea of what is the call schedule like? Am I going to be called in? What can I expect as terms of the emergency department? Because there were times where there would be a lip laceration and they would call us at 3 a.m. and they say, well, we don't deal with the mouth. Well, what's the difference between, suturing over here by the lip and suturing somebody's knee? They just don't want to do it because they know they have dental residents. The thing you have to know is our call schedule that we were on was 1 full week per month. So we would go Thursday to Thursday and then hand the beeper off to the next resident. And during that week, we could see anywhere from, I had 1 week where I think I had maybe 3 or 4 calls in that week, and it was oddly quiet, but I didn't say anything. I just, didn't look at the beeper. I didn't do anything, but I was like, this is great. This is a nice week. And the week after that, I think we had something like 11 mandible fractures that we had to bring into the OR to sedate and put them up. So you never know what you're going to get. So along those lines, how often would you say that residents are called per night? What kind of procedures are you being called in for? What can I expect in terms of what I am expected to handle in the emergency room? So if, for example, if an emergency room resident or attending called me in and the patient had a laceration from the bottom of their nose down to the front of their lip, we were sort of told, okay, the commissure of the lip and the labial tissue is very, very fine stuff to deal with. That's when you sort of say, this is not for dental, even though it's dealing the mouth, call the plastic surgeon. So you learn how to sort of define your role, but also knowing what's expected, because there may be some programs who say, hey, if they're there, we don't have plastic surgeons. You got to put that back together. If you're not willing to do so, maybe that's not a program that you want to venture toward.
And here's another thing I want you to comment on, because there's 56 dental schools in the United States. There's hundreds of them around the world, if not thousands. And it seems a reoccurring theme is like, I want to go to this dental school because they don't have any grad programs in endo and oral surgery and perio, so we'll get to see the patients. I've heard other people say, yeah, I did a residency. I thought it was going to be great. It had all this big name brand stuff, but they had all these residents and all these specialties. And if we went into the prosto, we just got the single unit crowns they didn't want to do. If we went to oral surgery, it was the oral surgeon. They basically just got leftovers. So when you're picking a GPR, an AEGD, or even a dental school, how much are you focused on? Are you going to be the low life chopped liver getting leftovers, or are you going to get to pick these cases? Do you think that's an issue or a factor?
Definite factor, 100%. You make a great point in that, because some of the programs that I had visited or looked at, the first thing I looked at was, does it have grad programs for certain specialties? And like you said, you may get the leftovers, because certain programs they'll come in and through the triage process, they may say, this is a tough case. We're going to send this to grad pros. I don't even get to see it. I don't get to make the call of what I can do and can't do. Somebody else that I don't even know is doing that. So that's a definite factor. The flip side of that I would present is, when I was in dental school, we had the graduate programs when they were there. When you're a 4th year and somebody comes in and, let's just say they have a missing tooth and you want to do a bridge, right? You can learn about a bridge, you can read about it, but until you do it yourself, it's a stressful thing to try to learn. And I feel as though at Connecticut, I was very fortunate because we work almost side by side with the residency programs. There were times where, I can still remember I was worried about, a perio concern with a patient that I was seeing in an operative chair, so the disciplines were sort of, I didn't want to rebook the patient. So you could go get a perio resident, Dr. Beliche, I still remember, and he would come over and say, let me just take a look and let me tell you what I think. And he's there to just even give a 5-minute, specialty consult. So you actually learn a lot from those guys while you're in school of how to approach that the next time you see it. In terms of residency, I wanted to be more so on my own and now start using what I had learned in school to try to take the next step and challenge myself to make these calls by myself, but still have the attendings who I can bounce ideas off of. The attendings that we had at the hospital never said, you have to do this or anything. They were there just basically hanging around saying, Dr. Gittleman, what do you think about this root canal? Ooh, I've seen this before. You definitely have to be careful because that root is going to be, curved distal. And when you do this, you have to bend your file 90 degrees to make sure you bypass that curve. So if you didn't ask, you wouldn't know. So I think it takes a little bit of initiative on your part. But like you said, I didn't like the residency program that had residents to do every little bit and piece of almost like a group practice that didn't function like a group practice.
So you're in a group practice now. So you've been in dental school, that's group. You've been in residency, that's group. You're in private practice now in two different deals, group. Do you think that it's just more fun to be in group, or are you thinking of the final plan solo for you?
For the longest time, I wanted to do solo practice, and I've listened to the podcast, and obviously we hear so often that, the earlier you're able to buy when you feel confident, long-term, the better it will be. One of the things I've sort of learned as I've transitioned into practice is the group practice model in terms of being able to have someone else there as a backup in terms of being able to manage family life in order to manage, certain procedures. Like, for example, we have patients who come into my Parsippany office that are sometimes get referred there and they need full mouth, work. It would be a very difficult case for me or one of the other associates I work with to do. But Dr. Gruber has been doing this for 30 years. This is something that he does very well. And so to have that as a resource when you're starting out is, I think, invaluable. And I've almost looked more into, I think group practice is becoming a little bit bigger. Solo practice is excellent, but if you're not there, you're not making money for the most part. To have a group practice model where you're able to sort of have a little more of a work-life balance may be appropriate if that's what you're in fact looking for. A lot of my attendings were in partnerships, 50-50 partnerships that were working extremely well between them. And, certain people have their patients or anything, but other practices are like, hey, the patients are the practice's patients. No one person sees this guy or this guy. And a lot from my experience, I personally have been swayed a little more toward the group practice model, at least for now, than I was more so when I was coming out of school or residency.
And why is that?
I just think for the position I'm at now, I feel very confident in the work that I do and the knowledge that I have, but I still acknowledge that there is a lot more I have to learn in terms of patient management, in terms of front desk management, staff management, the little things in a practice that you don't really know the ins and outs of yet. To just start from scratch or buy a practice because one's available may be a little difficult. And just to run that then by yourself could be equally as difficult, or like I said, put a new variable in that. Overall, once I get some more knowledge or once somebody has more experience, it could be beneficial to them to be on their own financially, but it's all about weighing the options of what you're looking for in a work-life balance, I think, as well.
And last but not least, we went over an hour. My final question, overtime question. Okay, so you finished dental school, you did your GPR, you did your AEGD. That's all behind you. What are you looking for when you were getting a job as an associate? You're working with two different dentists right now. You really had a lot of thoughts on how to choose a GPR. What were your thoughts on looking for an associate job? What were you looking for there?
Yeah, coming out and having so many attendings, we would get interviews and, go to different offices. I think I probably interviewed at about 8 or 9 offices before finally making my decision. The biggest thing I believe you look for is, are you going there to just basically be like a filler somebody who like somebody walks in the chair, oh, you'll handle this, and just check cleanings, and maybe you get fillings here or there, or you interviewing at a place that will treat you like an equal. And for me, one of the biggest things I was looking for was a continued mentorship, somebody who I can learn a lot from. The practice in Parsippany is a very large cosmetic practice. It's very high end, and that's something that I would eventually love to work with. But you have to learn how to manage those cases if you want to do high end cosmetic dentistry. So that's something that I wanted to balance with my office in Hackettstown. Dr. Paulson is one of the best dentists I've seen in terms of patient interaction, treatment planning, and just, getting patients to understand their dental needs, and just beautiful work that's done with like high precision and just running his office well. So there's a lot more bread and butter, I would say, with my Hackettstown office, and there's a lot more advanced in my Parsippany office. I would recommend to somebody coming out for an associateship trying to go between 2 or 3 offices if you're able to work in private practice. Because if you're able to pick up little things from 1 or 2 doctors to balance out, you may like one thing that this guy does, but hate another thing he does. And the other doctor does the other part really well and something else really bad. So you can sort of pick and choose what you're getting from an experience. And if you go to one practice where they say, we're going to work, have you work 5 days a week, but you're not getting a lot of chair time, you're just sort of sitting around. Well, what you fit into 5 days a week there, you may be able to fit into 2 days, full schedule between 2 different offices bouncing back and forth.
Yeah. And I think another thing that you might think, but you didn't say, is you got a job in 2 places where one has their mastership in the Academy of General Dentistry and one has their fellowship in the Academy of General Dentistry. And I swear, the people who get their FAGD and their MAGD, I figured out when you're out of school, they were happier, they were more successful. I mean, dentists who take 100 hours of CE a year always get enough knowledge and answers to stay on the right trail, to have a happy, prosperous, financially successful career. And that dentist who's all complaining that the stupid government's making him take these 3 classes to get his license renewed and is all upset, doesn't realize that so much of his unhappiness is because he doesn't know what he's doing in dentistry. He's fumbling around. His work's not predictable. Was the fact that they had an MAGD and an FAGD, did that register with you that was something you were looking for?
Definitely. I just think seeing the name and the letters after the name is, if you're looking to be someone who's interested in continuing education, it's definitely a factor, because you're like, okay, I want to get to where this person is. I want to learn from them how they got there. And I think one of the best outlooks you can have, if you just look at a baby being born, the most critical time for brain development is that first 3 to 4 years, right? And I would approach it no differently coming out of dental school. The first 3 to 4 years of your dental development is going to be the most critical and set you on a path for how you want to pursue your practice and how you want to be as a dentist, your quality, your standards. So learning from different people about how to have that quality and have those standards, I think, is very, very important. And so if you can sort of transition out and take as much CE as possible to learn from the people who have done it best, I can't remember if it was Tony Robbins or not, but someone had said some of the best minds in the entire world have condensed their life's work down to like 100 pages in a book for people to read. And some of these, huge, cosmetic cases or whatever you're looking for have condensed some of their sometimes their life's work into 40 PowerPoint slides for you to like look into and try to master as much as you can and get the most out of it. I think you need to take full advantage of that as early as possible to set yourself up for the next 30, 40 years down the road.
And that last quote you said was what?
It's something along the lines of that some of the greatest minds in the entire world have condensed their life's work and experiences down to 100 pages on a bookshelf.
Dude, that was an exact line out of A Beautiful Mind by
There you
Russell
go.
Crowe. My God, he's just, I don't even think he knows he's not Russell Crowe. He's quoting the movie. But hey, and then And then one thing we got to go. We're in double overtime. One of the things I said, there's so many books on leadership, and leadership is too complicated. Nobody's going to figure it out with geometry and calculus. So go back to yourself. What did you like who were the leaders in your childhood? Was it your coach? Like, I always thought that kids didn't follow their sports aptitude. They followed the coach that motivated them, that made them feel good. And so why did some kids go into wrestling versus basketball or football or hockey or soccer? And so go back. Who was the coach that connected to you? Be that person that worked with you. And so that's you. And what I would avoid, you talk about those first 3 or 4 years or so of development of, the young dentist always says, well, they'll pay 25%, but I don't have to pay my lab bill. And this place pays 30%, but I got to pay half my lab bill. Hey, what about one guy you admire and is motivating you and making you want to be a better dentist, and the other one is a toxic piece of junk that makes you feel bad and want to quit? I mean, quit, if you could just, and you know why Elizabeth Clemente probably dropped out of that matching program? If matching programs worked, then Tinder should be able to marry everybody in America tonight. I mean, if it's really just comes down to artificial intelligence, machine learning, big data, they should say, you know who your wife is? Let me tell you, it's this one right here. And it's not that way. It's so complicated. And what I want these young kids to do is, if you're working in an environment, and say you're some big DSO and the office manager is bullying you and making you feel bad and you're not reaching your goals, dude, just walk right now. I can't afford you to burn out, hate dentistry, not like it anymore. I want you to have a beautiful mind. I want you to find a place where you run 20 red lights on the way to work, that you can't, I hired an associate about an hour after I opened my practice because I just went from a dental school with 120 classmates to solo practitioner. And I was so dumb. Who did I hire? Another kid who just graduated an hour ago. It was Bob Savage. So it was 2 kids. I mean, if I had a smart business mind, I would have got someone 10, 20, 30 years experience. But what I wanted, I was in my sandbox playing dentistry, and I wanted another buddy to play in my sandbox with. And the most fun years when it was like me and Tom Giacobbe and Sam Dominic. And I mean, it was like 3 people with a shovel playing in a sandbox every day. And man, if you're running red lights, wanting to go to work because you mostly want to see the people at work when you get there. And that's why I've got a bunch of people that have been with me 20 years, because just they're having fun and it's not toxic. So that is so important. When I see people burned out, depressed, hate dentistry, usually at the somewhere in their life, professionally, personally, somewhere there's some toxic monkey in there that needs to be edited out of your life. So just if you want a beautiful mind, stay motivated, find someone who has their FAGD, their MAG, join the AGD, because those people actually like dentistry. Right. And there's a lot of people who hate dentistry.
Yeah, like you said, even when interviewing, it's maybe something that didn't stick out as blaringly obvious, but I believe Dr. Paulson and Dr. Gruber, both of their primary assistants that they work with, have been with them for at least 25 years.
I know, and mine quit like an hour before she made her 30 years. It's like, can't you just stay like another month just so I can say you stayed here 30 years? But yeah, that's, just dentistry's fun and life is fun. And I think you're going to be a summary of the 5 people you hang around the most with. And so if all 5 of your dental friends all hate dentistry and they just want to meet at a bar and drink and talk about how horrible dentistry is, well, then you're going to eventually think that. But if you find 5 guys that would rather do a root canal than play golf, my God, you're going to have a fun career. Thank you so much for coming on the show today, and sharing your thoughts on this stuff. You're fresh. You were just in it all just 2 years ago. It was really an honor to podcast you. Thank you so much for coming on the show.
Thank you. Had a great time. Pleasure meeting you.
And what is your next movie?
That I'm still not sure about. But I always laugh at like the old like daily shows and stuff that they had, like making fun of Russell Crowe and everything. So maybe I was watching reruns on that.
All right, buddy. Have a great day.